Hello everybody and welcome to the HacettepePathology.com. And in this month I'm going to show you a very particular tumor. This patient is 20-year-old female with a gluteal mass, and the mass is excised after the biopsy, and here is the excision, and we see an epithelioid neoplasm, and it looks like homogeneous. And when we come closer, we realize that, we further appreciate that this is an epithelioid tumor. But when we come more close, and we appreciate that these cells look rhabdoid, and they have very nice nucleoli, very prominent nucleoli, and all the cells are they look the same, and like a production of a factory. And as you see, we have this very nice plasmacytoid, or let's say rhabdoid look. And when we see this morphology, we have to use some bunch of, again, we have a mitosis. We have to use bunch of immune panel. So the first thing comes to mind is, as we have this rhabdoid tumors is desmin, and this tumor is desmin negative. And the second thing you should order is INI1. So this is INI1, and when we consider INI1, we have to look for the internal control, which is provided by endothelium and lymphocytes. And here, in this case, we have lymphocytes are positive as a positive internal control, whereas all tumoral cells are negative for INI1, which is consistent with the loss of INI1. So, of course, we have lots of soft tissue tumors, and when we consider INI1, the list is not so much. So we have epithelioid sarcoma proximal type, or malignant extrarenal rhabdoid tumor, or in this case the keratin. We have to order keratin to rule out extraskeletal the proximal type epithelioid sarcoma, but this tumor was keratin negative. The other thing comes to mind is epithelioid malignant peripheral nerve sheath tumor. So you should order S100, and this is S100, and this is the only type of malignant peripheral nerve sheath tumor which is diffuse and strongly positive with S100. So it's epithelioid type. So, and this is the diagnosis of this case: epithelioid malignant peripheral nerve sheath tumor. And this was SOX10, which is ordered in the biopsy, and it's also nicely and diffusely strongly positive. In the differential diagnosis, of course, if you don't order INI1, if you do S100, the differential diagnosis includes malignant melanoma, but malignant melanomas are almost never INI1. They almost never show INI1 loss. So again, we had performed the HMB45 and melanA in this case, and also they were negative. So this is a quite straightforward diagnosis of epithelioid MPNST. Thank you very much.